Hello and welcome everyone. My name is Aistė Štaraitė and I'm the chair of Heart Failure Patient Council and Heart Failure Development Executive at Global Heart Hub. Today in this session, we will discuss the International Heart Failure Patient and Caregiver Charter from the policy perspective. We will highlight the ways and what organizations need to know before taking the action for the policy impact. Today with me, I have the co-founder, managing director of the Health Policy Partnership and network director of Heart Failure Policy Network, Ed Harding. Hello, Ed, and welcome. Can I
Hi,
ask you
Aistė.
please to introduce yourself for a few minutes?
Absolutely. Aistė, it's a real pleasure to be here. Thank you for inviting me. My name is Ed Harding. I'm, as Aistė said, the Managing Director of the Health Policy Partnership. We're a health specialist policy consultancy working at the pan-European and global level. We're particularly proud of our work in heart failure. Our longest running project is the Heart Failure Policy Network, which seeks to advocate for heart failure at the government level and to secure effective national plans for HF across Europe and other countries as well. So it's a real pleasure to be here.
Oh, thank you very much for joining this session. All I can say, I have a greatly vast experience and knowledge in health policy, so I'm really looking forward for this conversation and like to learn more. As for the start of this session, I would like to briefly introduce the charter for those who probably haven't heard about it yet. So, International Heart Failure Patient and Caregiver Charter outlines a set of expectations and responsibilities to support the creation and implementation of an internationally accepted standard of care for individuals living with heart failure and their caregivers. The overall goal of this charter is to support the development of optimal, high-quality care and promote its adoption internationally across all healthcare systems. Global Heart Hub has launched the International Heart Failure Patient and Caregiver Charter in 2022 last year. The charter has been translated and it's available in 17 languages across Americas, Europe, Middle East, and Australia. The document has 40 patient and clinical organization endorsements, and Global Heart Hub already named 4 patient organizations as champions who led the localization of the charter in their countries. Those champion patient organizations' achievements of a great advocacy work are improving the outcomes of their heart failure patients. So, Ed, I would like to come to you and I would like to ask, as a policy expert, from your perspective, how the charter is different from other policy documents.
Thank you, Aistė. As you said yourself, I think what's so powerful about the Charter is it's co-developed with the entire HF patient community. One of the strengths of our arguments in heart failure is the sheer scale of the syndrome. As you know, 15 million people in Europe alone living with heart failure and their families as well. So therefore, the sheer weight of the fact that the Charter has been co-developed with that community and is so clearly now the manifestation of this joined and clear set of demands that community, I think is firstly politically in itself exciting and powerful. What else, of course, is fantastic about it, as you say, and we'll go on to discuss, I'm sure, is that the Charter lays out this clear set of expectations that resonate very much with what patients want to see, what will make a difference to them, and also what will make a difference to society and healthcare systems and the sustainability. And every patient organization can look at that charter and think, what is our view on, and all of these asks, do we have them in our country? So I would imagine if I were an HF advocate starting up a new organization, this would be a huge strategic direction to what we were planning to do and trying to achieve.
Absolutely, I couldn't agree more. And we are having a new as well session going on about the champion organizations. So we will hear from those champion organizations who actually did the advocacy work and actually took the parts of the charter and turned into complete policy change in their own country and continue improving lives for other patients. So if we look at the in general about the dream. Let's look at the dream a little, or the future, we can say. In your opinion, what we as a population and community potentially could achieve with the charter in heart failure globally, or even on a national level, or maybe both?
I think what we can achieve with the Charter, and equally must aim for, is the realization of all of the demands therein. The day will come when substantial effort, no system will ever be perfect, but when substantial effort is in place for every aspect of the patient charter, for example, on care plans, on accurate and timely diagnosis, on that respect and patient involvement in care, on highly effective patient therapeutic education. All these things are effective and entirely coherent with the guidelines. So our vision, our goal, our dream must be that this arrives, and I'm sure that's what we're going to talk about. How that's achieved then is a political fight and a campaign and a mission that will doubtless take a long time.
Absolutely. And if we think about it, my question was about the dream, but I think that dream is really achievable if we think about it, right? If more patient organization, more patient advocates stood up and really stood the voice of the patients and actually go and engage with the stakeholders, we could definitely, and we're already seeing some examples, there is a change. So if we talk, and what you mentioned already, a little bit more about the best practices, are there any best practices of how to get involved in the policy change? If, for example, I'm a leader of a new patient organization and I would like to seek a change in my country. So is there any best practices? Are there any key players that I need to approach? Any tips or tricks how to do so?
Absolutely. We could obviously spend a long time on it, and far many other people would have amazing things to say. People spend, I think, their whole careers in talking about policy theory. I'll try and keep it really grounded. I mean, to me, policy are the decisions taken by our government and our leaders that shape society through government as the arm of society in terms of finance and law. It's really, I think, that simple. Policy is a word that frightens some people. It sounds very abstract, but for me, it's very simple. It's the decisions that governments take or the decisions that they haven't taken. We or others object to. There are many other definitions of policy, and you should go and look them up. And I think the other key thing is to make the point that few governments do this in isolation. Governments are often very porous bodies. They will include academia, institutes, experts who come and go, and rightly patient advocates themselves as well on boards and others. And there's a process of discussion and scrutiny within what you may call government, between the civil service, between elected officials, between agencies. So all that's going on, and somewhere we have to, in our own countries and cultures, understand that, map that, and make, I think, very clear decisions about how to get involved. But if you are interested, there are models to guide advocates in the sort of process of policy making. Very typically, this sort of idea of, first you identify the problem, you define the problem, you review and then select the policies you want to see, you go for the change, you monitor, etc., etc. But I won't go into those in too much detail. I think it can sound like a lot to do. In essence, decisions and can we influence them?
Absolutely, and it's a great, and maybe that's what we can think about in the future of building the actual steps, so we can really showcase and support the advocates. Another problem that we quite commonly hear within the community is that we have an issue in our country. I kind of know what I need to go and what to do, but where is the beginning? So where is the start? There is no knowledge of what patient organizations have to be capable or what the impact to the policy change can be. Is there, in the channels, even when you search on search engines, you can find a lot of information about the policy. But what would you say as expert, what assets and knowledge patient organizations have to start all this process in terms of the policy change and policy impact?
Absolutely. So obviously the mission of the organization is absolutely critically important. So it may be very obvious or seem obvious to somebody living with heart failure or somebody who has a loved one who is, what your mission is. But actually, you may find this is where you could get challenged quite quickly. How does your personal experience or that of the group around you actually relate to a system goal? I think it's really worth thinking early on what is it ultimately that you want to achieve. Did to reduce mortality in heart failure? Is it to improve quality of life? How could that be expressed in ways that will resonate with government leaders, like reducing hospitalizations? And then around that, to go about working out your strategy to achieve this goal, of the interventions at play. So in your system, what's working, what's not. You won't be able to change everything, but you may be able to win a consensus for really high value new interventions. So off the top of my head, say investing in HS specialist nursing, or demanding that everyone has a care plan, or that everyone is seen by a specialist or person with HF interest 2 weeks after. Those are just examples of sort of tangible goals. But I think really starting with this strategy of what is it that we want to achieve? What are the system improvements that we want to see? How does this relate to what a patient would experience? And now how do we go out and explain that? Who is responsible for that change? What will their demands be as we engage them? What are their planning cycles? Who else do we need to have with us? So it may sound complicated, but actually it's just a logical process of working through. We know exactly what we want. And I think being able to translate a goal, a much bigger goal, into something really tangible over a 1, 2, 3 year perspective that someone can actually do. So, for example, a colleague said to me, he's very experienced chap in cardiovascular disease. He always said he gets very suspicious if anybody wants to just raise awareness of something, because it suggests that you don't know what you really want. I thought it was a great comment. It's no good just going into Parliament saying, did you know about HF? Or, don't get me wrong, that's important, but actually somewhere in your strategy has to be this really clear goal of exactly what we want to achieve in 2, 3 years. And I assume a discussion between you and your colleagues and others who will be choosing from a range of options to be confident that this is achievable, we can do this. And it's a logical progress for us as an advocacy group.
Absolutely. I think it's as well, I don't know if you agree with me, it's important to find the peers, the people who think the same, who can support you. It can be either different organizations within the country, right? So if they can support and towards your goal, then your voice can be stronger and bigger, right? And I think another highlight is that about the time, because sometimes patient organizations say or even think that, it might take a very long time to get engaged and to actually see some impact and see the results. But we have as well learned from our practice that some of the campaigns that were taken out within like few weeks and the results already seeing, and some agreements and approvals are already being done by the policymakers. So is there any concern about the time, or you just have to take as much time as it requires? What would you say?
You're certainly right. To your first point, yes, you really need to go with as strong an alliance as you can. So not only among other people with lived experience of HF, but also I would strongly suggest with other clinicians, possibly as medical and clinical advisors to your group, and other NGOs as well, possibly former politicians, as broad as you can. Somebody in a different piece of work I did in fragility fractures, a very senior person there with a great experience said something I had never forgotten. He said, you have to remember, and he was saying this to his community, when we sit down in a room with a decision maker, they already know we're going to talk about fragility fractures. And they of course, whatever we say will be seen through that lens of, well, that's your mission, of course, you would say it. So the wider, as upsetting as that is to hear, the wider group really has to come with you, people from all sorts of different perspectives. So I think that's a very important point. I think, as you said, resilience is really key. You may find incredible opportunity and be able to move very quickly. Never be ashamed of that. And you may, for example, personal connections with policymakers who may have experience of heart failure in their family can suddenly change everything overnight. There's also a risk that when those individuals go, and I know of a very good example of this in a big European country, where the departing Minister for Health, who was very supportive on cardiovascular issues, he was suddenly gone, and then all the plans that were developed fell by the wayside because this individual was the champion and he understood. He was actually a clinical doctor himself. So you be resilient, because take those opportunities, but you may get amazing early wins. Be ready for that long haul. I mean, some of the lead-in times on the system changes, training a specialist nurse or setting up a registry or embedding care plans, these will definitely take years. You may get policy wins quickly, like you win funding or policy recognition, but translating them into change on the ground is going to take time. But so yeah, I think resilience and that being in it for the long haul is really important.
Absolutely. I like the word resilience. That's one of the key words from my side as a survivor. So we talked about these steps and action and loads of great points that you mentioned previously. Is there anything that needs to be avoided? Any communication, maybe any collaboration? I don't know, language, like anything that comes to your mind that you really need to pay attention as advocate or patient organization, that, not to cross the line or something like that.
Question. Almost certainly, yes. I mean, at first, it's probably a really obvious point, this is off policy's general point, in your country area, know the laws and norms around policy and how you get involved and what public life expects from you. And, I think that should go as far as, good referencing or citing of your evidence sources. I always think if we write something, if, a parliamentarian could stand up in the national parliament and read out what we've said, it really had better be solid and concrete, or you could really let somebody down. So I think always, check your sources. If you see a really exciting, attractive figure, find out who said it, make sure it's viable, because it, could come back to sort of haunt you, some sort of promise of value or return on investment that, doesn't quite hold together. I think also, I think avoiding finger pointing, and I could well imagine, from my own experience of healthcare or others, if the system has let you down, you'll be angry and want things to change. And I think that anger has to translate into a positive value, positive vision for what has to be different, and also avoid generalizations about communities. So it's very common in health policy for there to be problems at primary care level. Primary care is incredibly overstretched and huge demands are placed on it. But, be careful. It's not that people in primary care aren't doing a good job necessarily. Maybe just they just can't work with what they're being given, or the expectations too high. So I think this sense that everyone who's gone into healthcare or politics has done it for the right reason, but what's the problems that people face? So I think that what we'd say in English, that's a finger pointing, that accusatory language can be difficult. And maybe one reflection is to each group is sort of, do you want to be on the inside or outside of the system? There are two different strategies. One is to befriend and be closer to government figures and to help them and align with them. Another is to sort of take an alternative approach of scrutiny and, sort of, what would you call it? Highlighting problems or failures or unmet promises. And you may find once you choose one track, you're sort of stuck on it. So maybe worth reflecting, how do we want to play this? What's right for us as people and our country?
That's such a great point. It's actually from my experience as well, and seeing other organizations as well, even in my own country, they take the different approaches, and even if you don't get connected with the stakeholders, with the policymakers from the first time, or with the Ministry of Health, it can put you down a little bit. That's saying you're not achieving some goals, but I would just say stay brave and keep connecting and keep trying, and at the end of the day, you will get recognized. And we see as well the examples that at the end of the day, those organizations are now sitting at the table with all the stakeholders at the meetings. So never let this disappointment let you down. So last question.
Yes. Sorry.
So last question I would like to ask is, we know the document is available. The chart is a great document. It's been broadly shared. Global Heart Hub is ready to collaborate with patient and clinical organizations for dissemination and localizations. What the encouragement message we can share with the communities today about the implementation of the charter on the national level and taking the action at the same time? What would be your message of the encouragement to them?
I would say that this is a very interesting time to take action on heart failure. I think there is a bigger problem that's worth mentioning, which is that society, our decision makers, have not really fully understood cardiovascular health overall, and have misunderstood a longer term trend of progress, often in acute events like, say, heart attacks or heart attack survival, or in managing blood pressure, cholesterol, stopping smoking. So there's been huge benefits from this, and that's absolutely fantastic news for society. But I think they have probably not grasped that there are bigger forces at play in an aging population, event survivorship that are that mean that our life expectancy is a growth in life expectancy is unfortunately stalling. And I think that's changing. We're seeing governments launch new plans in cardiovascular health, or advocates regrouping to ask them. There's a lot going on at the European level with the European Alliance for Cardiovascular Health. They're in a fight to get the European Commission and the European law handlers to mount an equivalent effort in cardiovascular health as they have done in cancer. But also, say, like in Poland, there's a new cardiovascular strategy, and other countries are following suit. Spain released one in 2022, really excellent strategy. So I do sense that tide is changing. That's great. Equally, as a heart failure community, we have to make sure heart failure is seen as an opportunity within that. It's not the thing not to talk about. It's not the thing that happens if something's gone wrong. It's the reality. 50 million people, and there's so much we can do to benefit patients and society if we invest in it. So this idea that it's this area of opportunity where we can tackle barriers and make a real difference, I would say that's a key message of support. And also, just from my sense of, at the, for example, at the ESC Congress, HFA Congress, earlier this year, the excitement around the knowledge that we're gaining into how heart failure arises and what we can do to better personalize those treatments, that's really taking off. And with the pandemic, you've got all these models of telemedicine that have been proven. I said all this is still flying around, and so much is going to come out of this. And I just sense this excitement. So my message of encouragement would be, please, I think we need you. This is a political battle. You actually, without patients, without political constituency, we won't see change. So you have to be there. So the great news is that if you are stepping up to be there, or you're growing or continuing your plans, that's absolutely fantastic news for your country and your community.
Absolutely, I couldn't agree. When you said we need you, I just nearly start crying. I don't know, it really touches, because that's part of my work. That's part of what I'm doing, and I'm trying to, see that change and make the change and inspire others and kind of educate as well at the same time. So it really speaks to me, and I hope it speaks to everyone else. Thank you very much, Ed. I'm extremely grateful for the time and this insightful session with you. I believe this conversation can spark the ideas, as mentioned, and improve the knowledge about the policy advocacy in heart failure with tools such as International Heart Failure Patient and Caregiver Charter. Thank you all for tuning in this session with Ed and myself. If you would like to read the charter, you can simply scan the QR code after this session. And if you would like to become a champion and collaborate with Global Heart Hub, please don't hesitate to reach me on the email provided. Thank you.